The pain in my leg is unbearable. You have to help me.
Hello, I'm Daniel and I'm an individual response paramedic. Can you tell me your name?
My name is Patricia. You have to help me.
Patricia, I can see you're in a lot of pain, but I need to assess your vital signs before I am able to administer pain relief and antiemetic to make you feel better. Do you have any serious medications, allergies, or questions before I begin treatment?
Patricia was in a critical condition when I got to the RTC. On immediate inspection, I could see that she had multiple serious fractures, lacerations, contusions, and was in extreme pain. Despite this, Patricia was in a position that enabled her to give informed consent, and so it's extremely important that I gained it from her before I began the appropriate medical procedures to stabilize her. By requesting consent and allowing Patricia to express her healthcare needs, I was able to take into account her preferences whenever possible.
Where is my family? Are they all right?
Patricia, I can tell that you're very concerned about your family. We are doing our best to get the rest of your family in a stable condition and transport them to hospital for emergency treatment.
Patricia is an elderly patient who is showing signs of stress, so it is vital that I show empathy towards her. Building an empathetic environment between Patricia and I will facilitate honest communication while helping reduce her stress and lower complication rates. By using interpersonal communication, I was able to identify Patricia's healthcare needs as an elderly patient. She is heavily devoted to her family, so the loss of her grandson Sullivan is likely to have serious psychological effects that will affect her health status.
Hi, I'm Daniel, and the patient you'll be taking care of is Patricia Jones. She is a 68-year-old female who has been in an RTC.
Miscommunication during clinical handover is a contributing factor to adverse events. I must use clear, consistent, and concise communication when handing over to the ED staff and ensure that I explain her injuries, vitals, relevant medical history, and administered medications to minimize the risk of an adverse event occurring later on. This will also assist her post-surgery multidisciplinary healthcare team to create a holistic patient-focused care plan for Patricia that accounts for the many socio-cultural, physical, psychological, and environmental factors which she is affected by.
Hello Patricia, my name is Narges. I am your assigned nurse for today. How are you feeling right now?
I'm in a lot of pain, and I'm very worried about my family. If you could let me know when they get here and if they're okay.
My job as a nurse is to make sure every patient is taken care of, provide administering medicines, and communicate with patients. Patients, family members, doctors, and facilitate the clinical handover, which is the transmission of professional responsibility, which in Patricia's case involves the transmission of all aspects of care from the responding paramedic to a collaborative health team. Patricia, I have been informed that you have a fractured pelvis and left forearm and multiple leg fractures. You also have some minor cuts on your chest and head. You have leg lacerations and penetrating fracture. I will need you to complete an admission form. Do you have an insurance?
Yes, I have private health insurance, but my husband, he's the one that looks after all of that, and he was in the crash.
Your husband will be arriving soon and we can get the necessary information from him. Do you have any allergies and what medication are you currently taking?
I'm allergic to some chemo medication that they gave me, and I got really bad sores in my mouth. And I also can't take Panadol because it makes me really confused, and I think I start hallucinating. And sometimes when they give me antibiotics, I get welts all over my body, but I can't remember what they're called. Oh, and I have a long list of medications, but I can't remember them, so I'll write them down on this piece of paper.
Thank you. I have all the information that I need. Based on your current conditions, you will most likely need to get some X-ray and CT scans done, which will be done by our medical imager Francis. I will be back to check on you regularly and take you to medical imaging. Before I go, is there anything that you need? It is essential to make sure the patient is emotionally stable so they can be comfortable during their stay in hospital. Comforting a patient in distress is an important goal for a nurse. They must ensure appropriate and effective methods of comfort to a patient based on their needs. It is also important that Patricia's psychological needs are met by communicating her circumstances and referring her to a specialist. Hello, Frank and Juliet. This is Patricia.
Hi, Patricia.
Hi, Patricia.
Patricia, we're part of your collaborative healthcare team, and we will be working together with you to ensure that your healthcare goals are met. Frank and Juliet will be explaining their role to you.
Hi Patricia, my name is Frank. I'm the medical imager here at the Royal Brisbane Women's Hospital. How are you feeling today?
I'm not feeling great. I'm still confused and tired.
My job is to create medical images of patients' injuries and provide advice towards treatment to their healthcare professionals within the collaborative team. I have a list of images we need to take today. We may have to turn you over and move you about a little. Will that be okay?
That should be okay, but you need to tell me before you do, just so I can brace myself.
It is important to let the patient know what needs to be done and how you need to do it, so they understand the procedure and are comfortable with what you are doing. The initial series of images from the time of the crash indicate a number of injuries that require immediate and ongoing treatment. A radiologist is assessing the obvious fractures, but has also identified a secondary brain metastasis from your previous breast cancer. After reviewing the x-rays of your feet and legs, they have also referred you to a podiatrist for specialist treatment.
Hello Patricia, my name is Juliet and I'm your pharmacist. I'm here to go over medications that you've been prescribed by your doctors to assist with your treatment. I'm also here to educate you on possible side effects and adverse drug reactions of your medications, as well as monitor the effectiveness of these medications. How are you feeling at the moment?
I'm very sore. I'm not sure what's going on.
So Patricia, your nurse has informed me that you're allergic to paracetamol, methotrexate, which was your breast cancer medication, and Septrin. Does that sound right to you?
I don't have any other allergies that I can think of. I'm in a lot of pain right now. Is there anything you can give me?
Your doctor has prescribed dexamethasone to reduce some of the swelling in your brain that occurred because of secondary brain metastases from primary breast cancer. This drug can cause hypertension and your blood pressure was high on admission, so I will get your nurse to monitor this closely to ensure your blood pressure doesn't get too high. After liaising with your healthcare pain team, they have decided to prescribe controlled release morphine to help ease the pain you're experiencing. There are a variety of adverse effects that you may experience with this drug, so I will be monitoring you to ensure that you're not affected by this. Do you have any questions for me?
So what's the plan going forward? What treatment am I going to get?
I'm working with your multidisciplinary healthcare team to formulate a plan to achieve your healthcare goals in an efficient and effective manner. A collaborative care model has been formulated with this team to improve the quality of care you will receive. I'll be back shortly to check up on you and monitor your progress.